Welcome to Deep Roots with NaijaBabeInTexas. Welcome to season 3. I know it's been a while. Thanks to all of you who've encouraged and provided great feedback to me as to how to do a better job with my episodes and also sharing how valuable they've been to you. I really, really appreciate it. We're going to do a great job this year of being consistent with our episodes, but this is going to be season 3. And so, episode 1, and our topic for this episode is going to be on mood disorders. Specifically, we're going to focus on depression and bipolar. I just want to say thank you to my guest for today's episode, Dr. Ajufo. She and I deep dive into this topic in a few minutes. But again, I just wanted to welcome you all to another episode. This is going to be episode 1 of season 3. As I mentioned, I have a fabulous guest on the show today. Her name is Dr. Ajufo. She's a licensed physician specializing in psychiatry. We will be discussing mood disorders, specifically depression and bipolar, in our communities. I know in my experience, and I'm sure this is for others, mental illness overall in our communities, we all struggle with it, right? And I think sometimes it's because we don't really understand it. And it's not something we see and feel every single day, that we don't get great insights into what, the impact it has on our families. But I do know that just within our African American, Nigerian American communities, there's that lack of understanding of mental health illness. We allow stigmas and our religion to impact our ability to ensure our family gets the care that they need. There's really that lack of understanding of the illness. People forget that mental illness is as severe, or can be as severe, I should say, as any other health disease, such as cancer, diabetes, etc. Our goal today, my goal and Dr. Ajufo's goal today, is to educate our audience on this topic. Affection disorder are a set of psychiatric diseases, also called mood disorders. The main types of affective disorders are depression, bipolar, and anxiety. Like I said, we're only going to focus on depression and bipolar, but we'll have another episode where we talk about anxiety. Symptoms vary by individual and they can be mild to severe. So stay tuned as I get into my deep roots and as we get into this topic. Thank you. Alrighty. Hello, guest, and welcome to Deep Roots with NaijaBabeInTexas. Today we do have Dr. Ajufo with us. We're going to be going over mood disorders. That's our conversation today, but specifically we're going to be focusing on depression and bipolar. So our focus today is to discuss the what, the when, the where around mood disorders. I'll just give you a brief definition before we get into introducing Dr. Ajufo. A mood disorder is a mental health condition primarily affecting your emotional state. It's a disorder where you experience or you could experience long periods of extreme happiness, sadness, or both. Certain disorders involve other persistent emotions such as anger, irritability. It's normal for your mood to change depending on your situation. So this is really what we're going to be getting into besides other things. And so welcome, Dr. Ajufo, to NaijaBabeInTexas podcast. How are you doing today?
Oh, I'm doing great. Thank you for having me.
Oh, thank you for being part of this. I'm really, truly grateful for you being able to take the time out to discuss this important topic to our community. So thank you so much. As we kick off, what's the meaning of your name?
Oh, the meaning of my name.
Yeah.
So Ijoma is mainly, it means safe journey, but it's really a name that's reserved for like the first daughter. Yeah, it means safe journey, but mainly like the first daughter of the family is
Okay.
usually called Ijoma.
Okay. So what side, I know Igbos are between, there's Anambra, there's Imo, there's Delta, we're kind of there's a group of us, right? So what part
Yeah.
of the Igbo community are you from?
Oh, I'm from Owerri,
Okay,
Imo State, right?
okay,
Uh, but my
okay.
husband is from Delta State,
He's
so
from Delta State,
yeah.
okay.
So I guess I'm just all around Igbo, right?
Yeah, you didn't veer far off from your your community, right? So that's
Yeah.
good. Yeah. Okay, can you give us a little bit of background on you, your personal background, your professional background? So you shared with us what the meaning of your name is. So what that means from to the audience is that you're Nigerian. So as she stated, the meaning of her name is Safe Journey, and it's typically given to those to daughters who are the first in the family. So, but if you can share with the audience little bit of background of of yourself, that would be great.
Oh, yeah. So I was born in Lagos, Nigeria, and grew up most of my childhood and early adulthood was in Lagos, Nigeria. I did my medical school in Ibadan. That's a year state. And then after medical school, I lived in Trinidad and Tobago for a little bit and practiced there a little bit with my husband. And then we moved over to the US. So now I live and practice in the US and I have my own practice. And yeah, so I live here in Texas with my three kids and husband and two pets and other families and extended families
Oh,
all
that's
over the
good.
globe. Yeah.
Good, good. And she has a great practice, by the way, Northridge Behavioral,
Yes, language
which
behavior.
is a Babcock Road in San Antonio, Texas. So just to let everybody know, but we'll share more details about her practice towards the end. So I know your career is in psychiatry medicine. So what do you love about psychiatry? Why
Uh,
psychiatry?
yeah, well, that's a very common question, right? Not to sound cliche, but
uh,
really, I like psychiatry because you kind of get to know the patient a little bit better, and then you kind of form a interpersonal relationship, and then you help the whole being, not just the
mhm,
mental health, right? Mental health
mhm.
is whole health, so you kind of
Yes,
help the patient the best way you can and more in depth and yes so yeah, that's why I chose psychiatry.
I like that word that you use as it relates to whole health because I think sometimes people don't realize that. I mean, with every disease, your whole health is impacted, right? But with mental health, what's really, I don't want to say it, more so unique about it is that once you're mental is not stable, it really does impact every aspect of your ability to function. So, in society, in your home, in your environment. So, really, by you taking care of that mental, everything else kind of comes together, right? So, for you to be able to live that whole being or whole life. Is that where you're coming from when you say whole health?
Yes, yeah.
Yes.
So the human being is like a whole machine, right? So
Yeah,
your
yeah.
mental health impacts every aspect of your life. So yeah, so when your mental health is not intact, it would affect your family life, it will affect
Mm-hmm.
your job, it will affect your relationships. So yeah, so that's why it's very important that we do not neglect our mental health. I would
Exactly.
say one. I hope I'm not deviating from the from the script, but I would say one. If one can say that, if one is allowed to say that, that one advantage of the pandemic is that it brought mental health to the
Yes.
forefront. Now,
Forefront,
yeah,
yes,
no one
yes.
can neglect it because we could all see the impact, and it
Yeah.
was yeah, and so yeah.
That isolation in itself just yes, I totally agree with you. So it's brought more of mental illness to the forefront for people to really take it seriously. So I agree. All righty, so let's get into it, right? My next question to you would be, what are the causes or contributing factors and symptoms of mood disorders? What causes it?
Okay, so
Eh,
that's a two-part question, right? So
yes,
you
yes,
asked me
yes.
what causes it and what are the symptoms. So those are two different questions. So the
Or
causes
contribute,
are
yeah.
the causes are it's really multifactorial, right? There is the genetic component, there is the chemical imbalance component, and that all kind of interplay and then leading to the manifestation of the symptoms you get. And then the symptom itself, so in regards to depression, so with mood disorder, mainly we two broad areas where we talk about, right? We talk about like the
Mm-hmm.
depression itself, which is like,
Yes.
we like to say like unipolar depression, and then you have the bipolar disorder. So with the depression, mainly, just not to get too technical, right? There are certain things we look out for. We look out for depressed mood, feelings of hopelessness, irritability, loss of interest in the things you previously enjoyed doing, changes in appetite, changes in sleep, changes in motivation, and sometimes when it gets severe, there could be recurrent thoughts of death or suicidal thoughts. So that's depression itself, right?
Okay.
With bipolar disorder, you have people experience like the depressive symptoms, and they also experience hypomanic symptoms. And when they experience hypomanic symptoms, that will be more like bipolar 2. And
Mm-hmm.
then you have those who experience mania and then depressive symptoms, and those are bipolar 1 patients. So the bipolar 1 patients can be more severe, and sometimes, and most times, when a patient has like the manic episode, they do lose insight, and so when they lose insight, they do most often end up in the inpatient unit because there could be a danger to themselves and danger
Mm.
to people around them. So
Okay.
so that's like the broad way to divide it without getting
Mm.
too technical.
Cool. Okay.
Yeah.
And and when you say they lose insight into what do you
Yeah.
mean by that?
Oh, so when they lose insight, so they are more impulsive. They do things that put them in danger and do
Yeah.
people around them in danger. They're not able to recognize that what they are doing is dangerous, and
Or
so yeah,
problematic. Yeah.
yeah. So that's the insight. So they are
Mm.
not able to recognize that, okay, doing this can put me in danger, can cause significant harm to me. That awareness is not there.
Okay.
Yes.
That makes sense.
Yes, at that point.
Okay. And thank you for that definition and description of the causes and the types of mood disorders. I know you talked a little bit about genetics and what are the contributing factors to mood disorders, to depression or bipolar, besides genetics, things of that nature. I'm assuming that there's some societal impact as well, but I'm not sure. I'm not the expert.
Yeah, so you're asking about the risk factors? Is that what you're talking about?
No, the contributing factors to somebody being depressed, having depression or bipolar, right? So you've
Yeah.
talked about it being diagnosed, what are the causes or the types, right? But what are those contributing factors to it?
Yeah, so definitely genetics plays a huge aspect in it.
Mm,
And then stress, and also sometimes you have some medication reducing depressive symptoms in some people, which is not really rare, which is not
mm-hmm,
really common. So that question, the best way to answer it is, I'm trying not to get technical, but it seems,
mm-hmm.
for example, depressive symptoms, you have like substance induced depressive symptoms. So that substance use can predispose to that, right? You
Okay,
have
yes.
postpartum depression, right? And
Uh-huh.
having predisposition and all around stress can be a risk factor for having that. And
Okay,
then, yeah, but genetics is a very big aspect in it. So that I don't
okay.
want to, yeah. So that's, I'm trying not to get too technical, but
No, 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 but
yeah,
that's
so
perfect. I mean, it's
yes,
just stress as long as people are paying attention to their stress levels, right?
yes, stress
Pain,
level, yes,
once you give birth to a baby, pay attention to, uh, you know, I would say, your stress levels, but you're predisposed to the possibility of having some form of depression, I would imagine, right? So, because they do talk a lot about postpartum, depression. So,
Depression,
and
yeah.
then, like you said, genetics plays a huge role also as well.
Mhm.
So, all of these contributing factors to, but not the only thing, because you also mentioned drugs. If you use drugs, it could flare up, right? Or increase your impact, right? So,
That could be a predisposition too.
John,
That could
yeah,
be a
okay, yeah,
predisposition. Yeah. So those I would say will be the
the main
main
things.
risk, yeah, risk factors.
Okay,
Yes. Hmm.
okay. Alrighty, so how does somebody get diagnosed with mood disorders, right?
Yeah, so if you notice a change or and you feel worried, then you reach out to primary care doctor, or you can reach out if you already have like a psychiatrist or a therapist. You can reach
Mhm.
out to them, schedule an appointment for an evaluation. So we do a in-depth psychiatric evaluation where we ask the questions to ask questions to get to
To the root cause.
to the root cause. And so we do this psych eval where we get a history of the illness, the duration, the associated symptoms, and review your. A lot of times for psychiatry, the initial evaluation is in there because we kind of go into like your childhood history and all that. So
Mm-hmm.
that also play a part. So an in-depth psych evaluation, and
Okay.
then when the diagnosis is made, then we can review the different options like medication and or psychotherapy and all that.
Okay.
Mhm.
So once somebody sees there's a mood disorder, because you mentioned earlier, if there's a change in appetite, change in behavior, change in there's certain categories that you've
Yeah, I
mentioned.
mentioned, yeah. So
Should
the most
yeah,
common, because changing, anybody can have change in appetite. So that's not like the
yeah,
number one.
yeah,
So the number
sleep.
one is just
Yeah.
persistent depressive mood and lots of
Okay.
interest in things that you usually find pleasure or joy in.
In
And
doing.
then in addition to that, then you have excessive fatigue or loss of motivation, hopelessness, worthlessness, current thoughts of suicide, changes in appetite, all happening concurrently, or at least 3 to 5 of these symptoms happening concurrently for,
Concurrently.
yes, at least 2 weeks. Then we feel worried because sometimes you can feel down for a day. That doesn't necessarily
Mm,
mean you're depressed. But when the symptoms is persistent for several days and there's loss of interest in the things you usually find pleasure or joy in, you're just persistently sad. Some will say they're just crying for no reason, they are overwhelmed, and things like that. And a lot of times, yeah, so that would be what how would be the best way to describe it.
okay, so typically, if you have those experiences, right,
Mhm.
three or more of those symptoms that you mentioned over a period of time. So if you as an individual or a patient recognizes that, then talk to your primary care physician, who
Physician.
can
So that's
then
a good place to start. And
start, yeah, and then get in front of a psychiatrist, and then they can then complete their own assessment to be able to determine what the issues are or what the next steps would be with trying to get that individual back to a healthy mental state.
mental state, yes.
Yeah. Okay. Okay. How common are mood disorders and who does it impact? Does it favor one group of people or the other? I mean, one group meaning more females than males, or is it just pretty neutral within both sexes?
Yeah, so that's a good question. I'm trying to open my PowerPoint to get the exact value, but females are more help seeking, so
Okay.
they show up a little bit. more than the males. They seek help faster, but the 12-month prevalent rate is between 6% to 7% in healthy adults in a 12-month period. So that would be how to and male and female. I think females are slightly more affected than male,
Okay.
but they also better help. They are help seeking. They
Mm. They're better trying to get help to resolve the
help.
issue
Yes,
quickly
yes,
than
yes.
well, which is normal because men are not really good at going to doctors anyway.
Doctors.
But
Yeah. And then,
but okay,
but bipolar disorder is a little bit different, though. Bipolar
okay,
disorder affects 1% to 2.5% of the general population, but the prevalence is similar across racial group and affects male and female equally, unlike
okay,
the depression.
okay,
Mhm.
okay.
Yeah.
So what I'm hearing you say is the bipolar affects both male and females fairly equally, right?
Mhm. Yeah.
Depression seems to be more towards females than males,
Yeah,
but the
just slightly,
folks
not so.
slightly, not yeah, not so much, but the folks who typically get more care for themselves or take more action would be females than males.
Yes.
Okay, so alrighty, people, you hear Dr. Ajufo. She's saying we need to, both females and males, take care of yourselves, but most importantly, males, when you have mood disorders, it's important that you take care of yourself because your mental health is just as important as anything else. So don't ignore those symptoms that you have. And if your family is around you and sees those symptoms, please make sure you take care of that, because I wonder if there's any correlation between and I'm just talking out loud, you may not know the answer, but I'm just wondering if there's more correlation to, because you hear more men having suicides than females, so I wonder if because
Mhm.
women are able to take manage that health aspect better, that's maybe the correlating cause to that. I don't know. I'm just thinking out loud.
Yeah. In
Yeah.
regards, so the data has been changing more recently. So,
Okay.
yeah, I wouldn't. Yeah. So, but definitely, depression is a predisposition. It is definitely predisposes individual to suicidal thoughts, bipolar disorder also, and all mental illness. The I would say one complication of mental illness will be like suicidal thoughts. So that's why
Hmm.
if you have significant struggle, it's important to seek help. And there's a
Yes.
lot of stigma attached to mental health. So, but even if you feel some kind of way, going to see a psychiatrist, at least start therapy. That's a good place to start. Start
Mm.
counseling, and most therapists are pretty good at letting you know that, okay, I think at this point we've exhausted the therapy aspect. It might be time to go to the next step. So yeah, so even if the ideal will be if you feel very different, you feel significant change in your mood and it's persistent, it's affecting various aspects of your life, it's to seek professional help. If you're
Yeah.
worried about seeing a psychiatrist, you can at least see a therapist, because
Yeah.
a lot of times mild depression therapy is enough, can be enough.
Hmm.
But if it's moderate to severe, where there's persistent depressive symptoms, then we will definitely will need to go to the next level. So,
Yeah.
oh yeah,
I
yeah,
totally agree with that. I don't think anybody should have any issues with going to see a psychiatrist. To me, a doctor is a doctor is a doctor, right? If your issue is psychiatry related, then go see the experts who can guide you. If your issue is, from another specialty within medicine, then go see that individual. Don't sell yourself short just because of the stigmas in the environment. At the end of the day, you have to take care of yourself, right? And
Mm.
be healthy. But like Dr. Ajufo said, if you have those symptoms and you have it for a long period of time, please go see your primary care physician. They'll guide you to the right person. And therapy doesn't hurt, because even while you're in psychiatry, you can still, while you're taking your medication and you're talking with the psychiatrist doctor who's assessing you and all of that good stuff. Therapy is also good value to add. I go to therapy and there's nothing wrong with it. It's good to be able to talk to somebody and let all that stuff
Yeah,
go. Yeah, just and to guide you accordingly. Sometimes they're not going to necessarily tell you what to do, but at least having someone to listen to and who can then help you through your journey
hmm
is important. Yeah,
yes, yes, definitely very important.
you know. So I think we've kind of talked about the management, right? Well, maybe not really, because we've kind of talked about it on a surface level, but not in depth. So management and treatment. What is the management and treatment? We talked a little bit about therapy, right? We
Yeah,
talked
so
about start. Go ahead. Go ahead. Sorry.
yeah, so definitely, like I said, you feel the symptoms, you get evaluated, and like mild depression, therapy can be helpful, but definitely when it's moderate and severe, then medication comes into play. And the most common class of medication used are the SSRIs and the Prozac, Lexapro, Zoloft, and these medications are relatively safe, and a lot of patients report significant benefit from them. So
Mm,
SSRIs are the first line, the most common, and we have other classes. We have the SNRIs like the Effexor, Duloxetine. We have the atypicals, and yeah, so lots, and even yeah, newer medications available. And then we have the old school medications like the TCA, the MAOIs, and sometimes some people do have who have significant like family history and other things going on, genetics combined, have more severe cause of like depression or then we sometimes even have to go further, do other things like we have like ECT, we have the TMS, we have the ketamine treatment, also known as Sobrato. So there are a lot of multiple modalities in which depression can be treated. And then in
okay.
regards to the bipolar disorder, what we do is the mood stabilizers. So the mood
Mm-hmm.
stabilizers can be the antipsychotics, and it could be antipsychotics or a combination of antipsychotics and mood stabilizers. So antipsychotics like Abilify, Vala, Calypta, we have Seroquel, then we have lithium, Depakote, Trilipto. So there are a whole different kinds of medication that can be used to kind of stabilize the
Nice.
medication. And
Sure.
very
Yeah.
important is compliance. So
Yes.
yeah, so compliance is very important because when you for the medication to work, you have to take it, and you have to take it consistently. So yeah, so will be like a summary of a way
Yeah.
to take care of all this. And then counseling and therapy, in addition to the medication, also is very helpful.
Helpful. Yeah. I have to agree with you on the being consistent with taking your medication. If you're not compliant, then you're not helping yourself to get
Mhm.
better, right? So, and I would say another good thing that I know, because just full disclosure, I have depression as well as PTSD and what else? Anxiety. And I have gotten good care from an amazing doctor who I'm speaking to right now. And it's really, really important to understand that if your medication is not working, you have that conversation with your doctor so that they can help you in balancing or finding the right balance for you, right? As she's mentioned, there is a slew of medication that's out there, and they're constantly doing research and getting better ones out. Everybody's body is unique and different, and there's always a good balance for somebody. So the fact that your medication may not be working is not a good excuse not to be consistent in taking your medication. What that is being talking with your doctor to be able to help you find that right balance. Would you say that as well?
Yeah,
Would you
yes,
agree with that?
yes,
Okay.
yes. Definitely, having, yes, the conversation and
Shani,
finding the right medication or medications that work for you
for
specifically.
you.
Yes, it's very important.
And would you also say that even other medication that you're taking that's separate from psychiatry, it's really important to understand all of that medication so that there's that right balance for the patient as well.
Yeah, yes,
Yeah,
definitely. It's very important that we know all the medication you're taking so that to avoid interactions or certain medications
yes,
are contraindicated due to various factors. So it's very important that that's one of the things we get during the initial evaluation. We want to know all the medications you're taking right now, the medications you've taken in the past, your the allergies with medications. So all that are the information we get, so that that kind of helps us make the right decision in regards to medication for you.
yeah.
Mhm.
So, in essence, what we've talked about today is really the types of mood disorders, right? Which is depression, bipolar, anxiety. We didn't get into anxiety today, but at least we talked about depression and bipolar. We talked about the symptoms could vary, right? Be from mild to severe, but it's important that if you have those symptoms over a period of time, right? Lack of sleep. What else did you mention? What am I
Depressed
losing?
mood,
Moods,
depressed mood,
depress. Yeah.
yeah, depressed
Eh,
mood, loss of interest or pleasure in the things
Passion. Yeah. If
previously liked,
yeah.
hopelessness,
Yes. Yeah.
worthlessness,
Yeah.
irritability, changes in sleep, changes in
Yeah.
appetite, changes in motivation, suicidal thoughts, all that.
Thoughts.
Yes.
So if you have that over a period of time, right, consistently, it's important to start the conversation with your primary healthcare physician who can
Yeah.
then get you with a psychiatrist.
Yeah.
Or, I mean, we're talking with Dr. Ajufo. For those of you who live in San Antonio, she's a great doctor. You can always contact her office and they can then provide you their evaluation and then go from there. But really, it's important that as you see those symptoms come up and it's been consistent over a period of time, either a family member or that individual, please go see a doctor so that you can get the help that you need. We also talked about the importance of therapy, right? During the process of talking with your primary care physician or even through your psychiatry support, right?
Mhm.
As you're doing that, please, therapy is also important. Sometimes, like Dr. Jufo said, depending on the type of depression you have, therapy may be sufficient, but even the therapist will be able to kind of guide you as to when it's important for you to start talking to a psychiatrist as well. Staying on your medication when you've been given medication or diagnosed as to what exactly your issue is or your illness is. Staying on your medication, it's being compliant with your medication is very important. Being able to talk to your doctor if you have any issues with your medication is important. But overall, I think one of our main goals today is just trying to get away from the stigmas around mental health, right? There are a lot of people who take these medications and they do very well and they're very functional in society,
Yeah.
right?
Hmm.
And so it's important that people know that there's care available for you to be able to live a very functional and productive life for yourself, for your family, for society. So, getting care is important, right? And for those who have suicidal thoughts, there are various phone numbers that are out there, groups that are out there to be able to support you if you have those thoughts. And We'll put that podcast as well at the end of the podcast so you have access to that information. Dr. Jafo, is there anything else that we're missing that we need to make sure people are aware of or people take seriously as it relates to these illnesses?
Yeah. So, also want to mention that we actually can do see people in Texas, and anywhere in Texas.
Okay.
So not just San Antonio, and
Okay,
then
perfect.
yeah. So if your suicide suicidal thoughts is actually an emergency. So if
Yes.
you're having suicidal thoughts and you're worried about your safety, talk to someone close to you, and definitely calling 911 or going to the nearest ER close to you is very, very, very important. And then there's also help available. So now we have like the 988 suicide and crisis lifeline. So you can send a message to that, and you have someone on that can talk to you and guide you also. So because for a lot of people it's kind of scary to seek help, and the
Mm-hmm.
stigma and the shame that comes with that. But definitely help is available. So 988 on your 988 on your phone, and or going to your nearest ER. In San Antonio, we have a lot of inpatient facilities that you can do a walk-in into if you're having such thoughts. So yeah, so there's help definitely available. Do not stay silent. Do not keep
Mm-hmm.
all that to yourself. Talk to someone. Reach out for help,
Yeah.
and help is always available. So
Yes.
so
Yes.
that's what we always like to let people know.
Thank you so, so much for that, especially the 988 number and the inpatient facility. It's interesting to see what Texas or at least San Antonio is doing around this inpatient care. But most importantly, people can reach Dr. Jufar at her practice, which is called Northridge Behavioral Health. Her website is northridgebehavioral.com, and she has an excellent staff, and they are always very helpful in trying to get you in and trying to get you the support and the care that you need. And their phone number is 210-475-3048, and they are on Babcock Road, so 2829 Babcock Road,
Okay.
Suite 126 in San Antonio, Texas. Again, thank you, Dr. Jufo, for taking the time to have this discussion with me today. I truly, truly, truly appreciate it. I hope the audience finds this information helpful and insightful or gains something from the discussion that we've had today. It's
Yeah.
important that we have empathy for people who are going through mental health illnesses. We continue to work on eliminating the stigmas and just support people with mental health, including the mental illness, including mood disorders. So
Yes. Like I always tell my patient, like, I don't want you to see depression, bipolar disorder, or any mental health challenges. So I always tell my patients, like, I don't want you to see depression, anxiety, bipolar disorder, or any mental health diagnosis or challenges you had, different from the way you see uh, hypertension, diabetes. If you have hypertension, you have to take your antihypertensive, or else
yes,
you're gonna have a stroke. So you have to deal with your depression like same way. If you have depression, you need to seek care. If you have bipolar disorder, you need to seek care, because if you don't, then it gets worse, and then the complications thereof would apply. So yeah, so
yes,
we really need to work hard on the stigma. That is the one of the greatest barrier for people seeking mental health care, because they're worried
yeah,
about what people say, they're worried about how people's going to look at them. And I think, though, in this society it's a little bit better, but like
better, yeah.
Nigeria, it is still, the stigma is still there, and we really need to work on that. And so hopefully we continue to work on that and advocate and educate.
Yes,
So
yes.
so hopefully that if there's one thing that anyone gains from this is, if you need help, seek help, okay? It's
Yeah.
very important. Help is available. There's so many options, so many medication options, so many research going on, and things like that. So more, we're learning to know more, and more informations are coming out. So
Mm.
let's seek help. Let's reach out. Let's not suffer in silence.
Yes, that's really the great message, which is not suffering in silence, right? So even for those of us who are Christians that go to church and keep using God as a reason not to get help, God does not want you to suffer in silence either. He
Yeah. So
created the med. He,
I also have a reply for that. So guess who
yes,
gave us all this
this
knowledge?
exactly
Who
God.
gave us all this knowledge? It's God.
God,
Gave us
yes,
knowledge. He is the one who gave us the knowledge, and he definitely doesn't want you to suffer. So
yeah,
yeah, so God, your medicine and therapy, you are good. Yeah, so this,
yes,
yeah, so yeah,
preach,
yeah,
yes.
so we need to, yeah, then yeah, so we need to work on that, because like in Africa, in Nigeria, even generally the black community, we're a little bit more spiritual, and somehow we kind of look at mental health disorders as like a punishment, a sign that
Yes.
you are not holy enough, you are not serving God enough. But that's not the case, right? So we should um, not tell people to just pray when they are depressed. No, that's not right. They need
Mhm.
to pray. It's very important, because not everybody who takes the medication that it works for. So you take the medication and you pray, and you also go to therapy, and then it works out for you. Yeah. So
Yeah, deal with
yes,
your issues, your traumas, your
yes,
everything to be able
yes,
to get you
yes.
to that best place that you need
You
to be.
need
God wants all of us to be in a good place, to be in a place of peace, to be in a place of joy, to be in a place of thanksgiving and just gratitude. And so once your moods are not where you need to be, like Dr. Jufo said, which I 150% agree with, if not 200% agree with, he created all this knowledge for a reason. So
yes,
he does not want us to be in a place of confusion, which is really
yes,
what mental health is. It's in a place of
yes,
confusion. So he
yes,
never wants us to be in a place of confusion. He wants us to be in a place of peace. So take this seriously, my people, and stop leveraging religion as your reason or other stigmas of what other people think about you. Don't Those people have problems too. So don't think that anybody that is looking at you does not have an issue. We all have issues in this world. What makes us different is how you take care of it and how you address it, right? And then you don't just leave it stagnant and not address it. Every issue is solvable. It's just a matter of what effort and time do you put into it to be able to take care of it. So
yeah.
um
So very important. Yeah,
yeah,
you can still be a Christian and treat your depression. That it's
yes,
not a sin to treat your depression. So
depression. Yeah,
yeah, so I
yeah.
always like advocate. I'm a Christian myself, so it's
Oh,
very important. Like I would tell anyone that if you feel that you're having symptoms of depression, seek help and
yes,
seek treatment, and do not do not stay in that place um, of depression, of illness, and not seek help. Okay, it's
yeah,
very
yeah,
important.
yeah,
It's all inclusive. You can pray,
yes,
you can take medication, and you can do therapy. You can
yeah,
do it all. Okay, but
yeah, yeah.
that's very important.
Yeah. And family members, if you see your family members struggle, encourage them to go get the support that they need, right? Because sometimes this mental illness, when your family members are not doing what they need to do, it really does have impact on the family and being able to support the individuals. So it's really important that you encourage your family members to get the care and the support that they need. So we all face challenges in life, right? And
Yeah.
it's important that we all speak with a professional, get educated, own taking care of your health, right? And to live your best authentic life as much as possible, which is really paramount. So we will all face challenges, but it's how you handle them, like I said earlier, that determines how you're able to live your best life. So be courageous. It takes
Yeah.
courage to get care, right? So be
Yes. Yeah.
courageous, be determined. Know that there's several resources available. As mentioned, there's 911, there's ER, there's Dr. Jufo's office, there's 988. There are inpatient care, outpatient care. So go ahead and get the support that you need. Just be open to putting your health first, asking questions, and live your best life. So that's what I would say.
Yeah. Yeah. Yes. Yes. And
Yeah,
yes. So also, so let's seek help. Let's uh, and talk to someone close to you and seek help. So
yeah.
that's it.
Yes. So I would say, Dr. Jufo, we're at the end of our podcast. Thank you, thank you, thank you for your time today. I really appreciate it. Thank you for your insight, your wisdom, and just taking the time to have this conversation. I know somebody will be blessed by this, and it would be of value to our community in one way or the other. So thank you for your time today.
Okay. Thank you for having me. So thank
You're,
you.
you're welcome. Thanks, audience, and
Okay. Thank
get
you.
take care. Bye.
Bye.